Welcome to Save Your Money, Save Your Teeth. It's time again for the podcast where curiosity meets dentistry straight from the experts. I'm Ian and I'm once again joined by Dr. Clifford Yudelman. We're taking a deep dive into the world of dental care from a consumer's perspective. And today, Dr. Yudelman from OptiSmile delves into your oral microbiome, a bustling community of microbes in your mouth. They're there right now. And also how its balance or imbalance can influence not just cavities and gum disease, but also your overall health. This is going to be very interesting, so let's explore. But firstly, let's say hi to Dr. Yudelman. Hope you're well.
Yeah, I'm great, thank you, and hope you're keeping well. Lovely to speak to you, and this one's especially for listeners that are especially interested in this type of thing. It's not an everyday subject that most dentists would talk about. I had to do some extra research for this one. All of the information that I'm giving is based on proper medical and dental journals. So I didn't just make this stuff up, and not all of it is very well known. So it could open up a few conversations.
Right, I love it. Let's get into it. Firstly, I want to ask you, Dr. Yudelman, what exactly is the oral microbiome and why does it matter?
The oral microbiome is a complex, it's an ecosystem, where things live together. In this case, it's bacteria, fungi, viruses, all kinds of stuff living there, inhabiting your mouth. And believe it or not, over 700 different species coexist in balance. Isn't that crazy to think?
Wow.
That there's 700 different species. And it forms in a healthy situation, it can form a protective biofilm that prevents colonization by bad bugs when it's properly balanced. And then disrupting, or in this case it's called dysbiosis, can permit an overgrowth or encourage an overgrowth of acidogenic, which it means acid-causing species, or which triggers cavities, or inflammatory species, which cause gum disease or contribute to gum disease. And then now there's lots more emerging evidence, and there's direct links between oral bacteria or microbes to systemic conditions like cardiovascular disease and diabetes and Alzheimer's, and we have done a podcast on that. Yeah.
Okay, and how does a healthy oral microbiome protect you against tooth decay and gum disease?
So there are lots of beneficial bacteria. One of them is called Streptococcus sanguinis, which is sanguinis. It's quite a nice word, actually. I like it.
Mm-mm.
And they compete. Yeah, it sounds like sanguine. I think that means relaxed. I don't know. It's a word I haven't looked up. I think it's a French word, but they compete with the acid-producing species for places to stick on your enamel. So those are the good bugs. They're the ones you've got in your mouth when you don't, drink too much Coca-Cola or eat too many sweets. And then the commensal microbes, those are the ones that sort of all live together. They produce alkaline compounds like ammonia from your diet, and they buffer acids. Like your own saliva and your own bacteria in your mouth can help to keep your mouth healthy. Over millions of years, they've all evolved to be there. They're meant to be there. And a balanced biofilm stimulates your own immune defenses and helps your gums to be healthy. And lastly, there's salivary enzymes and antimicrobial peptides in your saliva that work together with these bacteria to stop the bad bugs from causing problems. So they're all there for a reason.
And which factors can actually disrupt that balance inside your mouth?
Yeah, so that's what I was alluding to earlier. So if you take in sugar frequently, if you're continually snacking on candy bars or Smarties or any tiny little gummy bear or any sugar, even lots of tea. Every few hours you have a cup of tea with sugar in it. That feeds, oops, I better have a word with you. Cariogenic species so cariogenic species are cavity-causing bacteria, and we've definitely isolated another streptococcus called Streptococcus mutans, or SM. And these are the ones that start cavities. So if you're eating a lot of sugar, the sugar makes that plaque build up a lot quicker, the bad plaque. And then also disruption of the balance. Obviously, antibiotics can mess up this whole balance. But one of the worst ones is smoking and vaping. Changes your pH and your oxygen levels. And that they've shown shifts your microbial populations, the type of bacteria in your mouth, makes them go more towards the pathogenic, or the bad ones, the ones that cause disease. Pathogenic means disease causing. And then, of course, the one thing we haven't mentioned yet is poor oral hygiene, which lets the biofilm mature where it becomes too, it should be kept fresh. These bacteria keep reproducing. But if you just leave it, it becomes like a stagnant mess, and then the bad bugs love that, because deeper down there's no oxygen, and it's the ones, the anaerobes, those are the bad ones. So they live, in the dark, wet places between your teeth and under the gum.
That sounds quite scary, actually.
I tried to sound scary. I'm pleased it sounded that way.
Doctor, what are the oral systemic connections driven by microbiome imbalances?
Periodontal pathogens, or the bacteria that cause gum disease. There's a nice name coming for you here. It's Porphyromonas gingivalis. So Porphyromonas, Porphyromonas gingivalis, which is sort of your gums are called your gingiva. They've shown that these can actually get into your circulation if your gums are inflamed, and they actually promote atherosclerosis and cardiovascular disease. Isn't that amazing? Something from your gums can get into your circulation and get into your blood vessels. So atherosclerosis is where you're getting thickening or hardening of your arteries, and the cholesterol builds up. But a lot of that is started by or contributed to by these bacteria that live in your gums, if your gums are unhealthy. And obviously you get cardiovascular disease, which means heart attacks and strokes. This is serious stuff. There's also translocation of your bacteria in your mouth into your gut, which can also then cause inflammatory bowel disease and metabolic disorders. So I didn't actually know that. That's something that I found out when I was researching for this podcast. And then chronic oral inflammation will actually there's something I get tested regularly because I'm very proactive with my health. And there's something called CRP, which is C-reactive protein. So CRP is something, when you get your blood test, you can get a CRP level done. And if your CRP is high, that means you've got general inflammation or some inflammation in your body somewhere. And that is a big link to diabetes and arthritis. And then some oral bacteria make neurotoxins, which are basically poisonous against your nerves. Interestingly, they've implicated that as a possible cause of Alzheimer's when these neurotoxins go to the brain, which, all of this stuff is crazy to think about, that, brushing your teeth could save you from a lot of these problems.
Yeah, amazing how it's all linked. I also want to ask you, can probiotics or prebiotics play a role in your oral health? I'm sure they can.
Definitely in places like America, where they sell these things, they can. In South Africa, it's not easy to get them, so the answer is no, but you can get them online, and there's toothpaste now. So I was looking up and reading research on certain probiotics. One of them is called Lactobacillus reuteri, which you can actually get in South Africa, and I haven't seen it or recommended it for use for dental, but they've actually shown that this can help in reducing gum inflammation and pocket depth. So after researching for this podcast, I'll definitely look into that. We don't get a lot of patients at OptiSmile with gum problems. We used to see a lot more of it back 10, 15 years ago, but I'm sure in many practices they still see a lot of it. It depends where you are and so on. So then there's prebiotic compounds, something called arginine. These can help to feed the good bacteria and shift your biofilm favorably towards a healthy biome. And then clinical trials report that even a modest reduction in strep mutans is caused when you chew probiotic lozenges, that it actually competes with the bacteria that cause cavities. So that sounds interesting for me as well. And then there's a lot of long-term studies to try and obviously sell us more of these supplements. I think, I don't think it's going to be widespread, but it is interesting to see where the research is going, using good bacteria to fight bad bacteria.
I also want to ask you, how do everyday oral care products influence microbial communities?
So we often give patients antimicrobial mouthwashes that have chlorhexidine, not the over-the-counter ones, but special ones. And we make sure we give it to them in low concentrations so they're not too powerful. And also they're only used, say, if you've got bleeding gums, just to get a balance back in your mouth. We don't let patients use these types of antimicrobial mouthwashes long term because they can also suppress the good bacteria in your mouth. Fluoride toothpaste is very good for inhibiting acid-causing bacteria and to promote enamel remineralization. And fluoride, by doing that, it actually supports a more balanced microbiome. So we did do a recent podcast about fluoride versus non-fluoride toothpaste. And then there's some new pastes and things with arginine that raise the pH and which means it's a more favorable for better bacteria in your mouth. I'm not familiar with any of these in South Africa, but I'll definitely be looking into that. And then using an alcohol-free low pH formula that doesn't disturb your microbia, the balance of your microbials in your mouth, I think is a good idea. But I'm not a big fan of general use of mouthwash, unless it's just a sort of nice minty mouthwash that doesn't have too many chemicals in it. I generally don't recommend it.
Okay, and what clinical tests assess a patient's oral microbiome status, doctor?
So you can get all these DNA-based saliva tests and measure the bacteria, and some dentists that get into this are well known for it, and obviously the patients that are keen on that approach will find these dentists. Everyday dentists, I don't think, do much of this testing. I don't want to say anything good or bad about it. I have gone through a whole, when I was in Australia, I did a lot of saliva testing. I think in the end, the patients need to brush and floss and take some of the advice that we've given in this podcast and previous ones. I'm not sure if it's a specific case where a patient's got gum disease and they go to the periodontist and the periodontist just can't figure out how to treat them. They might do these tests and find that there's a particular bacteria that they need to maybe give them an antibiotic for or treat specifically. I'm sure in the future there'll be a lot of new treatments with genetic engineering and all of that. These profiles can be very expensive, and as I say, I'm not sure that it's for everyday use. You can culture patients, microbiome and monitor for yeast overgrowth. Again, I think in my practice it would be overkill, but these things are available. And the other thing is, you always have to interpret this along with the clinical signs. You can't just go in somewhere and someone tests your plaque and waves a magic wand or gives you a tablet to chew or a mouthwash to rinse with, and then, you can avoid going to the dentist for the rest of your life. I know it does sound like a nice idea, but I think we're a little bit away from that type of stuff.
And diet? How can your diet support a healthy oral microbiome?
Yeah, now we're talking. That's a much better route to go. because this also helps your general health. So eating high fiber fruits and vegetables, eating carrots, celery, apples, that stimulates your saliva, and you get mechanical disruption of the actual coarseness of the celery or the apple or the carrot. It actually helps to stir things up in your mouth. It's very good to keep your microbiome healthy. Eating yogurt has been shown to be very good, and things like that. And all of these fermented foods now, kombucha and all this sauerkraut. A lot of them you've got to be careful. The pH is quite low, and they can cause sensitivity and irritation. But when they've taken with meals and you don't overdo it, I think that's a good idea. And then, funnily enough, green tea has been shown to be very helpful for certain bacteria. And then limiting sugars and frequent snacking, then you starve those bacteria that cause cavities. They really love sugar. Limit free sugars, very frequent snacking. That will starve the bacteria that cause cavities.
And Dr. Yudelman, which emerging therapies target the microbiome for disease prevention?
So I did some research on this. There's sprays that they're looking to they're in clinical trials, so they're not marketing them yet, but they basically, you'll just spray this on your mouth and it will explode the cavity causing bacteria. There's things down the pipeline with peptides and antimicrobials that will target the bad bacteria without disturbing the good ones. They're talking about probiotic varnishes that we can paint on your teeth. Obviously, some dentists don't have much else to do. This sounds like a lot of fun. I'm looking forward to maybe using them in the next 5-10 years. And the last one is microbiome modulation via mouthwash formulas. They're making up these mouthwashes that have prebiotics and enzymes. So that's something else to look forward to in the future.
And then finally, what is your simplest daily habit to nurture a balanced oral microbiome?
So brush twice a day with a fluoride toothpaste. You can chew sugar-free gum with xylitol. That's supposed to be good for keeping away the cavity-causing bacteria. I think just follow some of the other tips of the commonly available things that are available over the counter now, and always check with your own dentist, and don't spend too much money on some of these products that are still being researched, because they haven't been proven as far as I can tell.
Dr. Yudelman, thank you so much once again for another very insightful podcast. We really appreciate you joining us and sharing your knowledge with us.
Pleasure. Thank you for having me on again.
Thanks to our listeners also for tuning in. Remember, while we strive to provide valuable insights, always consult with your own dental professional for advice tailored to your personal health. Don't forget to subscribe for more enlightening discussions, and join us again next week for more discussions. Until next time, keep your mouth and your health in perfect balance.
Discover the world of dental excellence with OptiSmile. Join us for a weekly podcast featuring Dr. Clifford Yudelman, a seasoned expert with 40 years of dental experience across 4 continents. Gain unique insights and expert dental advice by visiting optismile.co.za for articles that illuminate the path to optimal oral health. If you're seeking unparalleled dental care in Cape Town, get in touch with OptiSmile or book directly online on optismile.co.za. OptiSmile, where global expertise meets local care.